Hi, I'm Darya. I'm a nurse practitioner. What brings you in today?
I want to address some movement in my forehead and in my glabella.
Perfect. Have you ever had any kind of treatments for those areas related to neuromodulators before?
No, I have not.
Okay, excellent. So let me tell you a little bit about the products that we have and what they do. So there's actually in the US market, there's 6 products that are approved right now. I like to kind of think of them as they're almost the same, but they're different, kind of like Tylenol and Advil. Same kind of family, but we all have different preferences. As far as the neuromodulators go, there's 6 products. There's Botox, Dysport, Xeum and Jeuveau, Daxxify, and Latibo, which is a little bit newer to the game. Out of those 6, we carry Botox and Dysport and Daxxify. There's no right or wrong of which one you prefer to start with. We won't know which one you prefer until we try also. Every single muscle group that I treat has a certain required dosing. There's a bare minimum dosing and the most maximum dosing that a muscle can get. What happens is when I treat the muscle groups with either of these medications, that muscle will stop from contracting for give or take on average maybe 3 months or so. And then usually over time as the products break down, we start to get that movement back.
Okay.
Usually when we're new to all of these medications, and because our muscles are not used to not working, I'm almost forcing them to paralyze for some time. We might notice slight headaches. That's just a side effect that we get when we're new to all of these. That tends to be transient and it goes away in a few weeks. On average, dosing, everyone is different and it's tailored to every individual. However, there's different kind of averages. There's conservative small averages and maximum dosings that tend to work for majority of our anatomies. Again, we won't know what you prefer until we do them. I like to start off for preventative, give or take 20 to 30 units for the most common muscles in the forehead, most commonly treated. I'm gonna take a few glamour shots.
Okay.
And then I'm gonna step out and I'm gonna grab my units. I'm gonna have you look into the camera. And then get angry. And then raise eyebrows up. More. Excellent. And then before I step out, any big events coming up in 3 weeks or so?
Nope.
Okay. The most common side effects, aside from the headaches, the most common side effects anytime I have needles anywhere in the face, bruising and swelling. Bruising tends to last give or take about 2 weeks if it does bruise. I find arnica helps a little bit, and then swelling, those little bumps that it causes will go down in a few minutes.
Okay.
Okay, any questions?
Nope.
And here I'm just drawing up my units to treat my patient. Hold on. All right, go ahead and lean back. And I'm just gonna wipe with alcohol.
Okay.
And the most common or sought out after areas for treatment with a neurotoxin, such as Botox or Dysport, tend to be all the muscles that make up our forehead, which are frontalis, the glabellar complex, and the orbicularis oculi. So I'm going to start with my glabella, and I'm gonna first I'm gonna go kind of my mid, almost eyebrow line, and I'm just gonna inject a few units here, little poke. Doing okay? Mm-hmm. Perfect. And I'm gonna go into my belly of my corrugators. I'm gonna kind of pick it up, and I'm also, at the same time, I'm blocking, and I'm that foramen that's right over, kind of around my thumb area. Doing okay? Mm-hmm. And same on this side. Doing okay? Mm-hmm. And the muscles of the glabellar complex, they tend to bring our eyebrows together. They make us kind of squint or get angry. Okay. And here I'm going to ask you to get angry, and I'm going to find my tail end of my corrugator, and this little muscle tends to raise and lower our eyebrows, and I'm going to relax it. And when I relax it, the goal is to lift and open up my eyebrows. Doing okay? Mm-hmm. Same on this side. Get angry. Beautiful. And then relax. Doing okay? Mm-hmm. Good job. And I'm looking, I wanted to blanch and I wanted to cause that little bleb. Good job. And again, I'm blocking that foramen so my neurotoxin doesn't get into any other muscles. Next, I'm going to treat my frontalis. And here, and this muscle helps to raise and lower our eyebrows. I'm going to ask you to raise your eyebrows and keep them raised for me for just a minute. And I'm mainly trying to focus on the origin of my muscle, which starts in this vicinity. Raise eyebrows up. Doing okay. Mm-hmm. And then the theory is when my proximal end of my muscle is relaxed, the distal end will recruit and lift my eyebrows up. Doing okay? Mm-hmm. Good job. Beautiful. Good. And then as I get closer to my eyebrow territory, below my line of differentiation, I like to go kind of very superficial in order to prevent those little parentheses that we can sometimes get when this part of my frontalis is not relaxed. So I like to go very superficially into my almost dermal layer, little pokes. And here, I might not relax the muscle, so I might not freeze, but it should be able to relax the lines that we are getting, that we'd start to get. Try to stay maybe a finger width and a half away from my eyebrow so I don't get into that vicinity. Okay? Mm-hmm. Beautiful. And again, I'm looking for those low blebs. Good. As far as aftercare, if you're going to go and lay down, in the next few hours, keep upright about at a 45-degree angle. I like to recommend no pressure, no massages, nothing like a hot sauna or hot yoga for give or take. I like to be very conservative and cautious, maybe a week and a half.
Okay.
And then if you're gonna work out where you're gonna be sweating a lot, wait until tomorrow.